Medical tourism is a must for people that are seeking healthcare programs in other countries. And in Guatemala, we have been very lucky to have Lori supporting not only us, but supporting the patients she brings along.
In industrialized countries today, medical costs are astronomical.
We have been getting patients from the United States, from Canada, and from Europe because they like our services. They know we're qualified, we have our credentials, and also it's a lot cheaper to do it here than to do it in their countries.
I had cancer in my throat, I had in my lymph nodes, and so I was suggested to come here from another head and neck surgeon saying it.
Well, for me it was the cost factor. It's a really good idea to come here for healthcare. I had a baby here, so I'm very confident with the healthcare system.
I had to determine which doctors in the country were the best.
My basic training was done in Guatemala, and ever since I finished, I started with specialization trainings. The first specialization in oral and maxillofacial surgery, osseo-distraction course in Germany, bone regeneration in Spain, dental implantology in Mexico. Recently I just got back from Switzerland where I did a surgical fellowship in orthodontic surgery.
Studied in Europe for 6 years, worked there. First stayed in Switzerland and worked and studied in the University of Zurich, did some prosthetics there. Then went to Vienna, University of Vienna, studied there for 3 years, orthodontics. And then went back to Switzerland, worked there for 2 years in a private practice. I went to Switzerland and Germany to study my residency in ear, nose and throat. While being there, I spent 2 more years in Baltimore, Maryland at Johns Hopkins for doing my fellowship in head and neck surgery. I came back to Switzerland for another 2 or 3 years and then decided to come back to my country.
When I graduated, I went directly to Europe. I lived in Germany there and did my residency in obstetrics and gynecology there for the first 4 years, and then I stayed there doing the 2 other subspecialties, 1 year in infertility and the 2nd year in urogynecology.
Then I went to New York to do my general surgery in New York University and Bellevue Hospital, Columbia and St. Luke's and Roosevelt Hospital nowadays. Then I finished my training and I decided to come back.
I got a master's degree in Gallaudet University in Washington, D.C., where I specialized in education of the deaf and rehab services too. And then I did a fellowship in McGill in Montreal on pediatric audiology. And later on, I completed my AUD program, my doctorate program in audiology in Gainesville in the University of Florida.
I do speak more than 1 language, English, Spanish, German, some French and some Italian.
My staff can communicate fluently in English.
I think that it's amazing when you come here how everybody speaks almost perfect English.
What surprises people is the personal human warmth. The level of care is like nothing they've ever seen before. It's the way they're treated. They're treated like a human being, they're treated with respect. They're treated like they have a new friend, and they really care. They're just devoted. When people say, I'm at your service and it's my pleasure to serve you, they really mean it.
I think one of the things that people like about our healthcare or our health services here is the warmth. We get to know our patients a lot. I think that builds up a very nice relationship, and it's based on trust.
Has to be more personal. You should call the patient by their name. You have to establish a nice rapport with people. Then they trust you.
You have to trust your doctor.
And the more people get to know you, the more comfortable they feel with you.
The care here, I found far superior.
And in some ways I think it's even better than in the United States because you get more one-on-one care from your doctors, your nurses, the secretary in the hospital, etc., all the way down the chain.
I've just been really pleased that he's very thorough, he's very gentle, he's extremely knowledgeable. I've just been so fortunate to find him.
The care I've gotten here is, it's great. It's much more personal. It's the doctors are, much nicer. They treat you more like people than than numbers.
You feel like you're the most important thing to the doctor.
I'm really proud to represent them because we're in this together, just helping people get healthy and live longer. We have beautiful hospitals here. It's all very high tech.
Hospitals have increased their level of care, their level of services, the amount of services provided.
We have good labs here in Guatemala. We have the whole package we can offer here.
I'm going to Dallas to train with a specific system, a CAD/CAM system, because we're about to acquire the system for the office.
More than just a regular travel agent, I'm a medical tourism facilitator. There's 100 things I can help, every little detail they might need. You have an agent, a new friend, someone you can depend on to make it as smooth and stress-free as possible.
For medical tourism to work, we have to work with an agency.
I think it's a must, not only for their patients, for their care, and for us. Our patients really get a very nice support, and not only they have someone that speaks their language, that understands their culture, and also knows our culture.
Most of the patients, when they deal with going to another country, and just that makes them anxious, it might be overwhelming. So if there's someone, an agency or a person, facilitating that for the patient, I mean, it's a huge advantage and a huge difference.
Having Guatemala Medical Travel and Lori by my side is very important. I can manage everything inside the hospital, in my office. Those things are very important if you want to have a great medical experience in Guatemala. It's very important, and you'll feel like you're at home and with a friend.
From the day they come until the day they leave, we're going to be in good hands, actually.
If I had someone to help me out with that, that would be very nice.
She can really help these people. She has the contacts, the connections.
I think it's really important. I think that if somebody were to come here and be working with Lori, that they would feel special. Once you come here and you realize the service that we are provided with, you feel like, in my case, a queen.
We don't have just normal tourists. We have tourists who are either in pain or in recovery, and they really need some special, extraordinary care. The recovery is almost equally as important as the good surgery and the work that the doctor does.
We're always concerned about if they're going to have a procedure done, that recuperation is in the best way possible.
I love the people, I love the culture, I love the warmth. I speak the language. I'm proud to bring guests and clients here and show them how wonderful this country is and all the services we have to offer.
From the people from the States, it's so close. I mean, 2.25 hours from Miami. From the airport here in Guatemala, it's 45 minutes, it's safe.
We are near more than other countries. We are the heart of the Americas, remember.
I think it's a great tourist destination.
Really comfortable, people are very friendly. There's nice places to go out, to eat, to shop, to walk around.
It's my job to be here and help you make that as stress-free as possible.
She could help the patients in so many ways that is amazing.
Lori makes that process very, very easy, both for them and for us.
I feel very safe here. I've had a very good experience, a very good time here.
I trust them, and the price is a lot better too.
Guatemala is a great place. It's near the United States. It's an easy access here. We know how people there, what they expect, and we can offer that here.
That kind of care would never happen in the United States.
And I love what I do.
Every day you learn something. It's beautiful.
This is the time. We're ready now.
You'll be very happy and you'll have a nice experience.
So that when you go back to your home, you know that everything was done right.
Cheers.